Hi everybody, my name is Austin Perlmutter. I'm an internal medicine doctor and I'm an author. And what I've realized over the last several weeks is that the United States is moving towards the same thing that other countries have been doing with regard to isolating people, enforcing social distancing policies, that a lot of us are going to be stuck in our houses for the foreseeable future. And there's all sorts of stuff that we could talk about as it relates to coronavirus treatments, what's going on in other countries, what the spread looks like. But something I don't see enough people talking about is what can we do to mitigate the physical and psychological harms posed by this isolation that's going to happen as we enforce social distancing policy. So this video and this series of videos are going to talk about things like how to improve your social connection even when you're not able to physically be with other people, how to improve your sleep, how to improve your exercise routine when you don't have access to the gym, and a whole bunch of other factors which I believe should be helpful to people watching. Okay, everybody, the title of these presentations is Weathering the Storm. It's Physical and Mental Health Strategies During the Coronavirus or COVID-19 Pandemic. And what I want to do with these videos is to give general updates on where we're at with our information on the coronavirus, help you to have tools to improve your physical and mental health during this challenging time. But what I don't want to do with these videos is to provide individualized medical advice. So I'm not going to be talking as much about specific supplements for people with specific conditions. And I want to make sure that everyone understands this is not designed to replace the advice of any of these really wonderful organizations like the World Health Organization, the CDC. My goal here is to just give you some actionable strategies so that you can lessen the impact of this virus, not necessarily the actual physical effects of people who have the virus, but people who are trying not to get it and people who are perhaps struggling with what they need to do when they are at home with their physical and mental health. So let's do a basic review of where we're at today. Today is March the 20th and it's a Friday. We know that there are multiple treatments and testing across the world. There's been some interest in the Plaquenil or hydroxychloroquine as a possible treatment option, and especially with combination with azithromycin as a way of potentially lowering people's infective burden. We know that there are dramatic improvements that we're seeing in China with a really low number, actually zero in the last few days, of new cases in China's most infected region. And we know that in basically every other country, we're seeing a progressive rise in cases. Now, this rise is different depending on which country you're talking about. The rise is pretty rapid in a couple of countries, namely Italy, the United States, and some European countries otherwise. But perhaps most important as a takeaway right now is that the recommendations on what we're supposed to be doing to avoid infection with coronavirus and just in general are rapidly changing. We are seeing that in the United States, the citywide or countywide, as well as statewide and national recommendations are coming out each day, potentially multiple times each day, so it can be hard to stay on top of exactly what is going on. So I want to kind of distill down what are the key takeaways that everyone should be understanding, at least in the United States, as it relates to coronavirus. I think these are pretty generalized to other countries as well. The essential actions that all of us need to be putting into effect right now are to minimize physical contact with other people. This is what is described as social distancing, and it basically just means not being as close to other people so that we slow the spread of this disease. It's really not that complicated. It just means having more physical space in between us and others. The next thing is we want to minimize our exposure to non-human vectors of this disease. So that's trying to limit our contact with surfaces that might carry the disease. That means trying not to touch things that a whole bunch of other people have touched. And that leads to the third point. What we want to be doing right now is to minimize the risk that we are inoculating ourselves with the virus, basically that we are infecting ourselves. So that means we need to really do our best to wash our hands, especially when we're contacting surfaces that might carry the virus. And again, this is probably stuff that you already know, but these are the core bullets that really anyone who is worried about this virus should be putting into effect right now. So there's a lot of information out there about all of these potential treatment strategies and all the things you can do to boost your immunity, as well as just the general news on what is happening globally with this virus right now. But I think that where we're moving is that people are starting to realize the reality for the next little bit, which is we're going to be staying in our homes. And if this is the case, perhaps the next question is now what? Let's say you're doing a home isolation or you're going to just basically be minimizing your social contact. What do we do next? And what are the potential repercussions of all of this time that we're going to be spending in isolation? So, this is actually a really relevant article. It was published in The Lancet. It was published actually February 26th of this year, and it's kind of in response to what's going on right now with coronavirus. And the title of this article is The Psychological Impact of Quarantine and How to Reduce It, a Rapid Review of the Evidence. What they said in this paper is that of these studies they looked at, most studies showed negative psychological effects of this quarantine, including post-traumatic stress symptoms, confusion, and anger. And, we can understand that this is the case. We are taking people and we are cutting them off from their social support. We're cutting them off from their activities that they used to do to maintain good psychological health. And from this paper, I want to pull out some topics that I believe I'll be able to give you some insight into. And these include a sense of detachment from others. This is something that we see with quarantine. We also see insomnia, poor concentration and poor decision making or inability to be decisive, emotional exhaustion, low mood, and then finally anxiety, boredom, and stigma. So these are all things that I want to talk about in the next few days. Today we're really going to focus on this sense of detachment from others. So let's go back to this idea of social distancing. You've probably seen this in a whole bunch of different news reports. It's a popular term right now. What does it actually mean? So, social distancing, as described in this article on Johns Hopkins, is deliberately increasing the physical space between people to avoid spreading illness. It's very straightforward, but just as an illustration, if here's you and your neighbor in your respective houses, if you were meeting in the middle of the street to have a conversation, all it means is maybe you make some room. So maybe you go 6 or more feet away and you can still have that same conversation. Now, on a larger population-based idea of this, what it means is, we are going to be a little bit more separated, whether that's between cities, between counties, between countries. We're not going to be able to physically be as near the people that we care about. And you can see that they're closing down borders across the world. So we have to start thinking about what are ways that we can mitigate the harms posed by this physical separation. Some points that they make in this article from The Lancet is that when you activate your social network, even if that is remote, it's not just a key priority, but an inability to do so is associated with immediate anxiety and longer-term distress. And something they actually suggest in this is that social media could play an important part in the communication for people who are far away, allowing people who are quarantined to update their loved ones about their situation and reassure them that they are well. Now, I want to make a point here. When we're talking about quarantine, that's usually for people who have a very high risk of actually having coronavirus and who are sometimes legally obligated to stay home. But what we're now seeing is that most people are kind of moving towards this shelter in place, where they're basically deciding they're going to isolate themselves from their neighbors, from other loved ones, in an attempt to, as they say, flatten the curve, which is to lower the amount of people who are getting infected in the short term. So these are points that really apply to just about everyone right now. As I said in this study, social media is something that we should be considering. And as you may know from my work in Brainwash, which I wrote with my dad, we talk about social media as a potential challenge right now in that while we can connect with other people, it can be dangerous for our mental health. So here are my thoughts on that. When we're using social media, which is certainly an option and is certainly a viable option right now, we need to use it actively. There's actually data that says that passively scrolling or passively using social media, just kind of lurking in the background and looking at other people's feeds, is associated with lower well-being. So if you are choosing to engage with others on social media, think about posting something that's kind and supportive or engaging in a conversation with other people. Key takeaway here, everybody is stressed, everyone's anxious, people are scared. So in any interaction you're engaging in social media, try to do your best to be kind. Now I want to talk about some interesting stuff that people are doing to connect with other people digitally. There's actually some phenomenal instances of this, and one of the coolest ones that I've seen recently is this whole concert at home series. This one specifically is the Together at Home series. So here you see Chris Martin of Coldplay recently performed a concert for people who wanted to tune in. And this is a wonderful way that you can interface with other people as well as be connected through music. And the link, as you can see, is included below. So this is actually a site on Billboard.com where they're accumulating all of the different concerts that people are doing right now for free online. There's other stuff that you can do too. For example, there are now a bunch of authors who are doing free book readings, and this might be especially relevant, I should say, if you have kids, because it turns out that they're doing children's books. So if that's something that's of interest to you, you can look that up online. In this article, they say children's book authors have opted to share videos centered on their work that are completely free of charge while kids are at home. So if you have kids at home and you're trying to entertain them, this is an educational and enjoyable way to make that happen. Now, I want to also talk about some stuff that is just kind of interesting. There are some apps that are coming out that are designed to help mitigate some of the stress, some of the downsides of being on our own. This one is actually called Quarantine Chat, and the idea here is you sign up for this and they'll basically set you up with calls from people across the world. When somebody calls, it'll say Quarantine Chat as the caller ID, and it's going to match you up with a random person. It's not obligatory that you pick up, but the idea is that you connect with somebody, you talk about whatever's going on in your life, and it's a way of connecting people. So the take home from all of this is that social distancing doesn't have to mean social disconnection. Social distancing is physical distance. So as long as you're not in physical close proximity to other people, there are a lot of ways that you can actually connect with them and connect with people across the world. So what are those things? Let's kind of recap. Things that you can do to connect with others while you're trying to engage with social distancing are going to include phone calls, text messages, video chats are wonderful. I actually have one scheduled later today with some of my friends. Zoom and Skype are great platforms that you can do that. Social media, again, being conscious of the fact that you don't want to be a passive user, that you want to be on there, and honestly just try to be kind. This is really a great time to practice kindness and gratitude towards other people. Online concerts, online book readings, and as I mentioned before, there are some really cool new applications that, if you're interested and you're a techie type person, might be a good way to connect with others. You can connect with me. I'm going to be doing these videos, but you can comment on this video, and I have an Instagram, which is at Austin Perlmutter, if you want to reach out via messaging or if you want to comment on my posts. I'm happy to talk with you there. And I guess just to kind of summarize here, we have this wonderful opportunity right now to think through creative ways that we can connect with others. And I'd love to hear your opinions on other things that I've missed and that we can all use in order to improve our quality of life in these challenging times. Okay, so I hope this was helpful. We're going to, as I said, be covering a bunch of other topics. I'm excited to talk about the research on sleep, on emotional reactivity that comes from not getting enough sleep, and how we can do things like engage in mindfulness, as well as some at-home exercises to improve our physical health and to improve our emotional and psychological health while we're stuck at home. Thanks so much for watching.